Today I'm going to be doing my 29/30 week pregnancy update. I'm doing these 2 weeks together only because nothing really changed from then and now. Everything's pretty much the same, so I didn't really find a point in making two separate videos when everything pretty much stayed the same between these 2 weeks. So at 29 weeks it says your baby is the size of a butternut squash, and now I'm 30 weeks and he is the size of a cabbage, they say. They say length, or it could weigh around 3 pounds, which obviously you never know. Okay, 30 weeks pregnant, your symptoms: Braxton Hicks contractions. Again, same thing, happens sometimes, different days, happens, doesn't happen. Not everyone gets them though. I never got them with my son. I do sometimes now. Okay. Your baby bump is expanding quickly. Your belly's increasing size is a definite clue that your baby is getting bigger every day. Now he's weighing in about at 3 pounds, and he's packing on the weight at a rate of half a pound per week for the next 7 weeks. Wow. 30 weeks pregnant is how many months? If you're 30 weeks pregnant, you're in your seventh month of pregnancy. Only 2 months to go. Okay, you're 30 weeks pregnant, so you only have 10 more to go. Wow. Okay, many of the early pregnancy symptoms you thought you'd put behind you may be coming back to haunt you. At least some people. And at least to some extent. Like the need to pee all the time because your baby's head is now pressing on your bladder. Which is true for me. I definitely would agree with that. I definitely have to pee a lot more, just like I did in the beginning. It says tender breasts as they gear up for milk production. So yep, that's true. Fatigue and pregnancy heartburn. Heartburn is a huge one for me. It was what? Heartburn is a huge one for me. I definitely have heartburn really bad. With my first son, I definitely didn't have it that much. I had it a little bit, but not a lot. And this time it is all day, all night. If I'm sitting up, if I'm laying down, if I drink milk, if I take Tums, it's just absolutely horrible. For the heartburn, it says, these days you may feel as though you've gotten a flamethrower in your chest. Indigestion is one of the most common and annoying pregnancy symptoms, and here's why. The same pregnancy hormones that cause your body pelvic muscles to relax so you can deliver your baby also relax the ring of muscles that separates the esophagus from the stomach. The result, the food and digestion juices can head upstream from your tummy into your chest and throat, hence why you get acid reflux or heartburn. So yeah, I definitely agree with that for me. So some reliefs, I would just talk to, before you take anything, obviously talk to your OB, but my OB said I can take Tums or he can prescribe me something. So I tried Tums. I mean, Tums do help, but not for long. They help instantly, but it doesn't last long. So I would say my biggest symptom this pregnancy is definitely the heartburn or acid reflux for sure. Some other pregnancy symptoms you'll have at 30 weeks, it says, is change in fetal movement. You should be feeling your baby move at least 10 times in an hour. I actually just had my 30-week appointment today, and they said if I don't feel him move 10 times within 60 minutes, an hour, to call them and go in because something's wrong, because basically what he said. They definitely should be moving, like 100% for sure. There's no excuse, or maybe sleeping, or maybe this. They should definitely move 10 times an hour is what my OB told me today. Okay, bloating and gas. Your uterus expands and puts pressure on your rectum, which can weaken muscle control and lead to uncontrollable passing gas. Drink plenty of water to avoid constipation, which it's really good to drink a lot of water. I wouldn't say I really have that symptom as much, but I do need to drink more water. Stretch marks. As your skin stretches to accommodate your growing belly and body, you and 90% of other pregnant women are starting to see pink or red stretch marks. There is no miracle cure for stretch marks, so don't blow the bucks on expensive creams that promise to make them disappear. Creams may soothe your itching belly and lighten them in color, but it cannot make them disappear. Stretch marks for me, with my son, I got them on my thighs and my breast, and I didn't get any on my stomach, and nothing changed so far for this pregnancy. I didn't get any more that I've noticed yet, and I didn't get any on my stomach yet. Okay, now I read all of the symptoms and things from what they expect you to have. I don't know if I said this, but they also say the baby should be around 3 pounds, 16 inches long, which that's just an estimate. Today at my doctor's appointment, they measured my stomach and they said he's measuring exactly 30 weeks, so he's like right on track, which is the things I talked to my doctor about today that were bothering me were when I walk or sit down or like try to put my pants on, literally anything, like my crotch hurts super bad, like a dull pain. And I figured that it was normal. I just wanted to double check, like it never hurts to ask. So I just double checked. He said it's normal, and he checked him and he said he's sitting super low, so that's why he's like right on my cervix. Said that that's completely normal. Talked to him about my heartburn. He said, just told me things I could do to ease it until he gets here. Basically everything I had was normal, which is really good. The only thing I wanted to touch on was my glucose test. So I took my 1 hour glucose test. I got to the doctor's. They gave me the drink. I drank it. It was gross. Waited an hour, took my blood. Didn't think anything of it because with my son I passed it, no problem, so I didn't think anything, which I know isn't true because you can have 10 kids and only have it with one, gestational diabetes with one kid and not have it with the rest. So like 5 days later or something, they called me and told me that I failed it and I needed to come back and take the 3 hour one. The cutoff is 135 and mine was 170 something. So they're like, yeah, we definitely want you to retake it. So tomorrow I have to go in at 10 a.m. and I have to drink the drink and then I have to stay there for 3 hours and then they take my blood again. And if I fail that one, then that determines that I have gestational diabetes. So I guess we'll touch up on that when it comes, but hopefully that I pass the third one. I have to fast. So tonight I can't eat anything after midnight. So I'll probably do a video tomorrow on that of me getting it done. Hopefully I pass that one, like I said. I mean, it's not that big of a deal if I don't. Another thing I'm going to touch on is swollen hands, swollen face, swollen feet, stuff like that. So my hands are swollen way more than normal, so I had to actually take off my rings because I didn't want them to get stuck. So I take off my rings. My feet get super swollen. My feet get super swollen and uncomfortable, like at the end of the day, so I have to lay down and put my feet up. And my nose, I got the pregnancy nose, so that's, got it with my son too. It goes back afterwards. My nose just gets bigger and then goes back to normal after I have them. My face is swollen, so the doctor also said that's normal. It's just something they want to watch out for, check your blood pressure and stuff like that. So other than that, that is pretty much all for my 29-30 week update. Nothing really has changed. And I will show you my bump. Okay, so this is my bump from the front. From the side. On the other side.
I can't